Good morning, and thank you for being here. I'm Joe Ruffalo, General Manager of The Hill. We'd like to thank everyone for joining us in the room and online for our event today, Bang for Your Buck. Get the most from your 2025 Medicare drug benefits. I'd like to thank our sponsor, Alliance for Aging Research, for their support of this important discussion today. With major changes to Medicare prescription drug benefits in 2025, beneficiaries who hope to minimize their costs at the pharmacy counter need to stay vigilant in the coming months. What do you need to know for this fall's Medicare open enrollment period currently underway through December 7th? These changes, including a $2,000 cap on out-of-pocket prescription drug costs and a new program designed to help enrollees spread out their medication costs over the course of the calendar year, may look straightforward on the surface, but they come with some wrinkles. At the same time, Medicare is finished with the first round of drug price negotiations, but the method for how the program is determining the value of selected prescription drugs remains a black box. With the second round coming up, how can beneficiaries weigh in with policymakers? We're going to answer those questions and a whole lot more. But before we get underway, a few housekeeping rules, I guess. If you're in the room, please silence your phone. But we do encourage you to join the conversation online. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag #TheHillHealth. And with that, I'm delighted to get the program underway. We're going to start the program with a brief video, and then I'll be joined on stage with Sue. Thank you.
Medicare Part D is an optional benefit that helps cover the cost of prescription drugs. Recently, Congress set an annual limit on Part D plan out-of-pocket costs. In 2025, the annual limit will be $2,000. Having an annual limit is helpful, but it can still be a lot of money to pay. Fortunately, another new benefit, called the Medicare Prescription Payment Plan, helps beneficiaries spread their out-of-pocket cost into monthly installments with no interest or fees. It doesn't cost anything to sign up or use this payment option. However, you must sign up with your Part D insurance plan at least 24 hours before you pick up your prescription. You can't sign up for it at the pharmacy counter. Also, you must sign up for the payment plan every year. You can do this at any time, including during open enrollment. Once you decide to participate, you won't pay anything when you pick up your prescription. Instead, you'll be billed later by your Part D plan and will pay in interest-free monthly installments. Talk to your Medicare Part D insurance plan provider to learn more and visit www.loweroutofpocketcosts.org.
Please welcome to the stage Sue Peshin, President and CEO of the Alliance for Aging Research, joining Joe Ruffalo in conversation.
Excellent. Well, thank you so much for being here today. It's good to see you.
Medicare Part D is an...
Or not. Maybe we'll watch it again. Can you tell us in the audience about Medicare open enrollment and what changes to expect, especially in the Part D part of this for 2025?
Absolutely. And I just want to give hats off to Adina Lasser. I'm going to do my best to channel her today. But everyone should know Medicare enrollment is happening now, and it runs through December 7th. And more than any other year, we're really recommending that current beneficiaries and those who are signing up for the first time pay special attention to reviewing their Part D drug plan offerings. And if you're a current beneficiary or you're helping somebody who is, this is the year to review your plans to make sure it's going to provide the best coverage for your prescriptions, also at your preferred pharmacy. And this is all for next year, for 2025. And that's because in 2025, beneficiaries can expect two major changes in their Part D drug plans. The first is a $2,000 cap on out-of-pocket costs for prescription drugs, which is huge, and that will make a big difference for beneficiaries in terms of their affordability. And the second is something called the Medicare Prescription Payment Program, which we saw in the video, but it's going to require a lot of education, which is why we're repeating it again and again. And this new program is going to allow beneficiaries to smooth their out-of-pocket costs into monthly payments throughout the plan year, like a lot of people can do with their gas bill, but you were never able to do it before with your prescription drugs. And there's no interest or fees, and that's especially helpful for folks who experience high levels of cost at the outset of the year before you meet that $2,000 cap. And there's a few things we wanted folks to know so that they get the most out of the program, and I'm repeating some of the stuff that you saw in the video, but it bears repeating. You have to sign up for the Medicare Prescription Payment Plan directly with your Part D insurance plan, and you have to do it at least 24 hours before you pick up your first prescription medication at the pharmacy. You can't sign up at the pharmacy counter. It has to be through your plan. And you have to sign up for the option every year. Once you sign up this year, though, you're good for 2025, and you can do it during open enrollment or any time throughout the benefit year. But you're not automatically re-enrolled every year. And then after you enroll, you don't pay anything at the pharmacy counter. Instead, you're going to receive a monthly bill from your Part D plan, and it'll spread those costs out for the remainder of the year.
It's great.
Cool stuff.
Well, where can folks go to get more information on this?
Absolutely. So a little bit of self-promotion.
Please do.
We have a new resource at loweroutofpocketcost.org, and that's where you can get the video that you viewed. We have it in a slightly longer format. We have it in a 30-second PSA format. It's free, downloadable. We have it in English and Spanish. And we also have a social media kit if your organization or if you're in a Hill office and you want to spread the word to help a lot more people. So again, loweroutofpocketcost.org. The next is the State Health Insurance Assistance Programs, and we're going to be hearing from one leader in Maryland today, which is great. SHIPs, for short, offer free, unbiased, one-on-one counseling on Medicare options, enrollments, and changes. And it's a really valuable resource for personalized guidance. And again, completely unbiased. You could go to shiphelp.org and click on Find Local Medicare Help. And the last place you can go is Medicare.gov. But Medicare.gov is actually where a lot of brokers go. So for some folks, it can be a little harder to navigate, but it really is the most comprehensive source for information on plans, benefits, and costs. And the Plan Finder tool is useful for comparing options.
So Medicare just finished the first round of drug price negotiations, but there seems to be some murkiness around exactly what that all entails. Can you tell us about a recent report you had just put out that goes into a little more detail about the value there?
Yeah, absolutely. So CMS really, the Centers for Medicare and Medicaid Services, hasn't really said much about how they're valuing the medications that they've selected for direct negotiation. And we know that traditional methods of value assessment, or how we value medications, are generally, they're considered discriminatory by the National Council on Disabilities and by a lot of patient organizations. And Medicare's not allowed to use them as part of the Affordable Care Act. They were banned from using what are called quality adjusted life years, or QALYs for short. So the good news is we think Medicare really has the opportunity to be a leader in this space, especially because they've stated they're looking at real world evidence. And what real world evidence is data that's taken from real people who are actually using the drug. So after they've already gone through FDA approval and the clinical trials, what's happening in the real world? And that's not usually used a lot of times in value assessment. But the question is, what are they using, right? So we thought it would be interesting to work with Milliman. And I know we're going to hear from Bruce Pyenson, who's a very well-known actuary. He was on the MedPAC for a couple of terms as their lead actuary. And they helped us to come up with a sample framework. And it was called SOLV, SOLV, which stands for the Standard of Living Valuation. And it's a new approach to assessing value that connects socioeconomic factors, so basically standard of living, income, and also, other types of factors in your life that have an influence on your standard of living, to health outcomes. And standard of living is known to play a significant role in determining health outcomes, but traditional methods don't really use those. And unlike the QALY, it doesn't size up the individual based on how old they are or what kind of condition they have or disability that they have, so it's not discriminatory. So what can folks do to weigh in, on the process? As we go into the second round of negotiations, which is going to happen, at the beginning of February, beneficiaries can really advocate for the use of other types of patient-centered frameworks like SOLV. We're not saying it's the only way to go, but it's a great way that is not discriminatory, and it ensures that the unique needs of older adults and people with disabilities aren't discounted, that they're considered in the process. And we also want to see beneficiaries and more disease advocacy organizations participate in the listening sessions. Medicare's already said that they're going to be continuing these listening sessions next year. We want to see more diversity. in the types of groups and actual beneficiaries that participate. And then we want folks to contact their policymakers. And you can do that through organizations like ours at agingresearch.org. You can work with PAN Foundation, coalitions. We organize a lot of groups together, and we really want groups to get involved.
That's wonderful. With the last minute, is there anything else you'd like to reinforce for the audience?
Absolutely. We just really want to make sure that folks check out their formularies in their Part D drug plans. As you know, I mentioned before, there's likely to be a lot of changes. Some of them are really good, like the out-of-pocket cap and the Medicare prescription payment plan. But there's also a lot more that the Part D plans, the insurance companies have to pay into the Medicare program starting next year as a part of drug pricing reform. And as a result, we're worried that there's going to be a lot more what's called utilization management. So messing around with people's formularies, maybe not having the same drugs that you usually take on your preferred list. So, you know, they might switch up the medication on you. They might ask you to try a different medication before the one your doctor recommends. That's called non-medical switching. I take care of my mom. She notices when a pill looks different from what she's used to taking. That can cause confusion and worry. So we really want people to check their plans this year. If you do nothing else, don't get caught off guard.
Well, thank you very much. A lot of really important information.
Absolutely. Thanks for having me.
Absolutely.
Good
Thank
to see
you.
you.